Meanwhile, Kano State government has announced the extension of the restriction of movement order in the state by 1 week to further combat the spread of COVID-19 in the state. Commissioner for Information, Mohammed Garba, said the decision was reached after due consultations with the federal government and key stakeholders in the health sector. The statement, which acknowledged the toll of the measure on the residents of the state, called for patience and support as the fight against the pandemic continues. Now, joining us today on Political Update is Prince Sule Ikosani, a public affairs analyst. Thank you for joining us.
Thank you for having me.
Let's start, from the first story. Now, the economic conundrum is, how much is it in terms of easing of the lockdown? How much easing of the lockdown will ensure, economic resurgence without jeopardizing the gains of the 5 weeks of restriction of movement?
Yeah, it's a very dicey situation, however, but government actually has no choice because of if you look at the informal sector, which is the private sector, it's actually employing the higher number of people in the country other than the public sector. And the longer these places remain closed, the likelihood that some of these businesses could actually go a bit down, and that might affect our employment status. A lot of our people will lose their jobs. So I'm sure the consideration government is looking at is allow a partial ease of this lockdown. Some of these businesses could actually follow the rules which is stated in the template. People could actually subject themselves to this, social distancing, put on masks, maintain the hygiene, do little of businesses and go back to their homes, which our country, because of our population and the index, a lot of our people have violated most of that. And that brings me to the issue I was very worried about, is if banks have actually decided to open some of their branches to render these services, why didn't they open all their branches and enforce the same rules that they are enforcing in most of these branches? Because you can look at maybe places like Kano or Kaduna or Abuja, you discover that maybe like a First Bank have maybe like up to 60 branches. They might just decide to open 2 or 3. And if you're opening 2 or 3 and you're allowing customers to come, why don't you open larger number, enforce the rules and ensure that fewer people are online and fewer people are distant themselves. They get into the bank, do what they do, and they go out, and you close on time. But they do that. But I think afterward, maybe they realize that that hasn't really helped. And in our marketplaces, the only state I can tell you that was smart to have brought this issue of market sanity is Kaduna. Kaduna enforced markets in areas like, if you have 6 areas in Kaduna, he insisted that if you have an area like Kao, should have a mini market close to the people, where people will come out, do what they do, and go out. Most of those big markets, he ensured that they are closed. And that's how it's supposed to be, because if you look at the whole of Abuja, there are other smaller markets that are bigger ones. Ensure that those smaller markets that can service that community, they open for few hours. Yes. Because by the time you open the bigger ones, a lot of people will come from other states and several other areas from night and day, and there will be a lot of people jamming themselves. But I'm sure it's a work in progress. This is the first time we're facing this kind of pandemic. The government is putting this policy so that we can gradually get to understand that hygiene is very important in most of our localities. Because one of the things we actually forget is that masks, washing our hands, and all this can only be successful when we decide to ensure all our prayer areas in villages, our churches, people are informed very well about hygiene. It doesn't cost much to ensure that before you walk into the mosque, if you have to get into a crowded mosque, because some of these areas in some of our villages, I can say like some of my villages, there are areas I went in some of my villages, some people don't even believe it. We have to keep on advocating to them. This is for your health. It's a very difficult thing. The government is in a very difficult position to actually ensure that these things are happening. And one worry I have, which is, I saw churches and private organizations donating areas for isolation. What is going on with the primary health centers that the state has? We have 774 primary health care centers around the country, in every local government and ward. Why don't you put generator, clean them up, and ensure that you use them for isolation centers so that it will be sustained? Because at the end of this
period,
after the pandemic, these things will go back to the church. And this, the advantage that people will enjoy is that when you fix these places temporarily for the COVID, after the COVID, people will still enjoy these primary health centers, and services will continue to be provided by our
capacity
states.
as well will be built in the process.
Yes.
Okay, I will come back to this, but of course, the last report was talking about extension by a week in Kano. Some states are, easing the lockdown. Some states are also extending. It's different strokes for different folks. Is that some kind of scorecard?
Yeah, like you see, Kano. That brings me to a very vital issue that is in our minds. We have informal, so-called people called Almajiri that have populated about 30% of Kano. If the state government have decided to move these people to their respective states, the states that are receiving these people should have a plan. What is the plan? If you are sending your kid from Sokoto to Katsina to go and study Quran, you can as well ensure that informal schools for learning our Islamic lessons in our states are empowered and they are part of the government academic structure. Which means if you have 200 Almajiri schools in a local government, there is nothing wrong that state will try and intervene, ensure that these people are having places to stay, they have schools to go. Mechanize, get machineries and clear the land. Encourage these malams to get into farming, because that is the gold mine in our area. That's the gold. And that brings me to an upload I have to give Mr. President when he insisted that we have to get into serious agriculture when he came into power. Because that's the only security right now. Oil is going away. The post-oil matter is what we should be talking about right now. Because if we don't concentrate in the diversification of this our economy towards entirely the whole of our energy in agriculture, you know what hunger is now. It's going to come and it's going to hit us so hard. So this is something that the state to take advantage of the force of labor. These children, and some of them are men that have gone back to their villages, encourage them at the local level, let them, these informal schools, inculcate them, integrate them into the government academic structure, finance them, provide hospitality for them, ensure that they engage in agricultural practices in their domains. In the next less than 10 years, we're talking about a big economic boom in most of these areas, if you know what I'm talking about.
All right, let's move on very quickly. Before we take the story from the isolation center, we understand, of course, that the legislative arm is also trying to back the executive in this palliative measure as well as the social intervention program. Let's take that report. Before we go, we return to the legislature. Now, General Jeremiah Hussein is a senator representing Plateau South Central District. Being a career military man, he says the fight against COVID-19 must be dogged and systematic, with information sharing at the center of the... Like the senator said, he says because they are not saying it is difficult to give information at the grassroots level about the clear and present danger of a pandemic on rampage.
No, I think it's a very wrong perspective that there is no disease that people see. It's only when you get sick that the symptoms manifest. I remember some of these viruses that are asymptomatic. Some people will have it.
For a while.
Symptoms are not there. That's why we said in our communities where people are not well informed, hygiene, our health workers at the community level should enforce hygiene everywhere. It's normal, like I'm a Muslim. If I want to say my 5 daily prayers, I do ablution, I wash my hands, face and all that. That's hygiene for me. It cleans me. Imagine I have to use a antibacterial or soap or something to wash my hand and be able to do that. Or you have to wash your hand to get into the church or to get into your house. This is something we do at we can enforce this hygiene. That's the only thing, because if you meet and tell that person that if he doesn't keep that, he's likely going to get sick. Because that's all they want to hear, that there's a sickness around and it's everywhere. If you don't keep yourself clean and your environment, you will actually be infected. And these are the information that we should use our traditional institutions, at the grassroots, our churches, our mosques, religious leaders, let them inform these people at every level. Because remember, when we're talking, there was a pandemic in 1918 that has destroyed over 20 million people. If you look at the history, you see it's worse. But over like almost nearly 100 years now, people are just getting to see another pandemic now. People are dying. We're running into hundreds of thousands around the world. The issue is that we have to learn from it. Our economic disadvantage, our health infrastructure disadvantage at our grassroots level, those are the things we should be very, very worried about. Because I am worried. I'm in my village. There's a secondary center. Around there are primary health care centers. When someone is sick or he has symptoms, we should have health staff in those areas that will be able to take your sample, go to urban area, test it, and isolate you in those areas. There are hospital units built with chairs and all that. In the event they find any primary health care center that was supposed to be built and it wasn't built, they will investigate who was supposed to have put all these infrastructures. Because so that our village people, our fathers and our grandmothers in our villages will enjoy health care post-pandemic. It's not that now they should, because the state is creating isolation center here. No, I am against the fact that a state governor or someone will say that he is standing waiting for a building to be donated. You have existing structures in your state. There are existing hospitals that are empty. Practically, the health staff are in the state. They don't go to those communities hardly to go and work, except when there is a strict supervision for them to go and do that. Okay, state ensure that these are going to be termed isolation centers. These are health centers. We are going to be putting people that will see symptoms and they are sick. We'll ensure that lights are connected and everything is there. My brother, at the end of this COVID-19 pandemic, which will go, 90% which are living in our rural areas will enjoy health care in our villages. Because if you are not opportune to have that opportunity, and you're living in your village, you have little symptoms, you get sick, it's only when they bury you that people will come and start saying he was sick for this ailment or that ailment. So our attention, and all of you, especially the media, should be focused on the state. What infrastructure are you revamping in all your localities to accommodate this emerging threat, which is affecting the entire world right now as we're seeing it?
All right, we've had Prince Sule Ikosami, public affairs analyst, giving us so much insight, especially in terms of public health. We'll probably continue this discussion because time is not that much. That has been Political Update for today. God willing, we'll be back again on Friday for another package. My name is Fisai Ogunfe. Thanking you for staying tuned. All the best. Enjoy the rest of your weekend. Keep it locked on the Nigerian Television Authority, where we give you the very best of news, reviews, previews, and interviews. Stay safe.